I'm delighted to be here. I'm bringing a somewhat different perspective to this. I'm an emotion scientist. I was trained as a social psychologist. I study basic mechanisms of emotion with a focus on positive emotion and emotion regulation. And more recently, the roles that emotion plays in the development and maintenance of our close relationships, as well as in behavior change, including behaviors around substance use, as well as other kinds of appetitive behaviors. And it's interesting, I made the transition into working in the substance use space a little over 10 years ago now. And when I did that, my husband, who is also a research psychologist, who also studies emotion, said, "So you're an addiction researcher now?" And I looked at him, I said, "Why do you think people take drugs?" And of course, the irony is this: he started his own career doing research on alcohol. So, but yeah, that's why I'm here. And actually, a big part of what I'm trying to do is build bridges, both across disciplines that study various different aspects and processes related to substance use and addiction in addiction science, but also build bridges between basic science that's related to those processes and the translational and applied work. And so that's really what I'd love to do today. As an emotion researcher, I study this. When I talk about emotions, I am talking about theorized but relatable, let's put it that way, phenomena in which we react to some event that has taken place in the environment. It can also take place in our memories, in our imaginations, whatever. But we're responding to something that has happened that we interpret or appraise as being meaningful for outcomes that we care about. And these can be our own outcomes or outcomes for somebody else or for the world, but they're outcomes that we're really invested in. And something has happened that has powerful implications for that in some way. From an evolutionary perspective, we would say it has fitness implications, but as humans, that gets a lot more complicated, right? And so that intertwines with our understanding of the world as being consequential in different kinds of ways than survival and reproductive fitness. When that happens, we perceive that the idea is this emotion mechanism of some kind in the brain kicks in. And the result is this suite of functional responses that help us to deal with that situation. And those can include nonverbal expression, changes in our facial expression, our posture, our voice, as well as verbal expression, physiological responses that prepare the body for some kind of action or in some cases inaction, biases in the way that we process information, what we pay attention to, how we interpret it, even very rapid and subtle and kind of under the hood ways of processing information that guide how we're going to respond in that situation, motivation and action that's geared toward dealing with the situation. And then as kind of a readout of all of this, subjective feelings and affect are what we notice. And those, some people argue that those are incidental and others argue that they are functional, that what those potent subjective feelings do is call our attention to this situation, make sure that it's at the forefront of what we're dealing with. Now, I'm very far from being the first person to suggest that emotions are connected with substance use, right? We've known that for a very, very long time. Here's mostly what that looks like, though. So the general framing of this is the very well-established finding that, broadly speaking, over time, stress, high levels of stress and emotional distress are predictive of substance use initiation, escalation, addiction, and relapse. And that happens through a variety of mechanisms. One of those mechanisms is self-medication, of course, but there are others as well. When we're under stress, we experience increased craving, generally speaking, not just for substances. Later on, I'm going to talk a little bit about some work that I've done on sugar consumption, and you see the exact same thing there. We also see impaired impulse control and delay of gratification. So you add those three things together, and of course, you're very likely to get increased substance use in someone who's inclined to use substances at all. The evidence is somewhat complicated about stress as an immediate trigger of alcohol and other substance use, and it may depend upon the substance, and it may depend upon a number of other moderating factors that we don't understand as well as we kind of need to and should. But that link is very clearly there, and of course it's the focus of a lot of the work and theorizing that is connecting emotion and substance use. For all of these reasons, there is a proposal that emotion regulation might be an important part of the solution, whether we're talking about prevention programs for youth or treatment. I adopt James Gross's definition of emotion regulation, which is really the only one that matters, certainly in my field, and I think offers a number of important benefits for conceptualizing this space. Gross defines emotion regulation as processes by which individuals influence which emotions they have, when they have them, and how they experience and express those emotions. And an important feature of this is it's pretty agnostic as to whether we're talking about positive or negative emotions, whether what you're trying to do is increase or decrease the emotion in question, and how you go about doing that, right? And so it gives us a lot of room for saying emotion regulation, broadly speaking, is just trying to have some influence over how we feel. And we do that all the time in lots and lots of different ways, and we use many strategies to do so. Now, substance use disorder diagnosis has been linked to greater self-reported difficulties with emotion regulation. And this includes not buying that emotions can be regulated, that that's not a thing, that we don't have control over emotions. Actually, lots of people believe that, but that belief is linked to problems with substance use. Greater difficulty controlling impulses, especially when you're upset or distressed. So that stress impulse control thing I talked about earlier is amplified. And then more reliance on just hiding your emotions. We call it expressive suppression, but it's just trying to conceal how you feel as a strategy. And for all these reasons, it's been proposed that training in healthy emotion regulation may be a valuable component of prevention, harm reduction, treatment, and recovery interventions. All of this is great. I 100% agree with and endorse all of this. What I would like to emphasize today is just how much bigger and more important this space is than the link between stress and substance use. So I'm going to put a claim on the table right now that substance use fundamentally at its core is emotion regulation. And that if we think of it as such and treat it as such, and then apply the theory and empirical evidence from basic emotion research, or affective science is what we're now calling the field. I'm actually here in Portland right now at the annual meeting of the Society for Affective Science, talking to you from a hotel room. That if we take that knowledge and use it to think about how to incorporate this general principle into both prevention interventions and treatments, we have an enormous amount to learn. We can really inform that work in lovely ways. So what am I saying? Okay, well, let's just think about some of the drugs that people take, just as examples, right? We can talk about dopamine and all of the stimulants that amplify dopamine receptor activity. One very strong characteristic they have, and arguably the reason that people take it, is to feel more energized, more excited, stronger appetitive motivation, and greater confidence, right? These are the feelings that come with cocaine. And, you know, I'm going to put a set aside here for obviously initial experimentation, which is very important among youth, peer pressure, and purely cue-driven use. I acknowledge that all of those things are very real and don't necessarily directly involve emotional goals. But we do have a lot of emotional goals, and a lot of our substance use involves those emotional goals in some way. And this is one example. Another is opioids, right? So we're targeting now the beta endorphin system, which we think of primarily as a way of it's like our pain management system. But there's also extensive evidence showing that that same physical pain mechanism is involved in social pain, in grief, in rejection, in loss, and that this circuitry can help flip the switch from pain and grief to, I'm using the term serenity, which is a weird word, but the opposite of pain and grief, right? The sense of all is well in the world, all is okay. There's lots of ways we can mess with serotonin. And the substances people use to mess with serotonin also mess with other things. So you can't just reduce it to serotonin. And to be honest, like a lot of medical psychiatry, we don't entirely understand how this stuff works, and we're still working on it. There's a lot to learn. But, you know, when we just think about the substances that are used and the affective states that they produce, that people take them in order to get, those include ecstasy, right? MDMA, which includes a number of dopaminergic effects around energy and whatnot, but also very characteristic. And in that community, one of the primary affective states that people talk about is this feeling of cuddliness, right? Affection and closeness and the sense of well-being that comes with that. And then, of course, we can talk about hallucinogens like psilocybin, which produce a likelihood of a psychedelic state, right? And people can seek that can take those substances, and often do, in order to seek some combination of humor, right? Because your mind kind of flipping between concepts has a way of producing humor or entertainment, and also on wonder. So it may be that we are actually seeking these positive states when we use substances, and fairly specific positive states, as well as simply trying to reduce distress. So the aims of my talk today, and what I'm going to do is not dig too deeply into any one of the studies that I'm going to show you. I'm going to breeze through the method somewhat. I'm happy to send more information at any time. But my goal is to get through this and leave us with, at least 10 minutes to spare for questions and answers, and a little bit of a conversation about what this looks like, because it's a fairly broad talk in terms of the range of work that I'll cover. So my goal today is to share some examples of where addiction and prevention research has built, in a very small way, on lessons that come from basic affective science. So I will briefly introduce something that we've learned in basic emotion research, and then say, here's what this looks like when you apply it to addiction and prevention research and what we stand to gain. And then more broadly, encourage addiction science generally and youth prevention in particular to expand its theorizing beyond the model that says stress drives substance use, so we need to deal with the stress. And then enhance the nuance and the theoretical grounding of efforts to include emotion regulation training in particular in interventions. And those lessons are these. I'm going to present one study, or in one case, a pair of studies that addressing each of these points. The first is that which emotion we're talking about matters, including when we're talking about distress, right? That some of the risk for substance abuse may be specific to particular emotion states, and we don't know anywhere near enough about that. That the goal of emotion regulation, where we're trying to get with emotion regulation, is consequential. That the outcome you care about matters. We have a tendency in emotion regulation science to talk about good and bad emotion regulation strategies. And increasingly, there's recognition that the whole good versus bad thing is really oversimplifying, because it does depend upon what particular outcome you're interested in. That the strategy you use to regulate emotions is consequential, because lots of strategies make us feel better, but they all have other consequences as well. And sometimes those other consequences are really important for the behavior that we're interested in when we're working in behavior change space. And finally, as a positive emotion researcher, I'm going to put in a plug for positive emotions and say we tend to be really, really focused on reducing distress, but positive emotions really, really matter too. And there's one place in which addiction science has leaned into that. I'm going to propose another one and say there's even more there to explore. Okay, I have to warn you that I can't see questions in this mode. So if there is one that is time sensitive, that's like a methodological question or a clarification question, it would be awesome if someone could sort of just jump in and interrupt me. So please do feel free to do that if that's something else.
Okay, yeah, thank you. There is one
Okay.
question. The question is not craving itself an emotion, the emotion of desire?
Yes, I actually put that into, in my own taxonomy, I have a construct that I call appetitive enthusiasm that includes craving. And when I measure it, I call it enthusiasm/craving, or craving excitement. And that's exactly what I'm talking about. So yes. And regulating craving is obviously a really important part of what we're trying to do.
Thank you.
You bet. Okay. So which emotion you're experiencing matters. The basic science, the basic affective science work that I'm drawing from here is a really, really rich literature. I will acknowledge that it's controversial. At the same time, I will say that 80 to 85% of folks in my field agree with the statement on this slide, that a rich literature documents differences among what we call discrete emotions, sometimes referred to as basic emotions. I prefer the term discrete, especially negative emotions, around stuff like nonverbal expression, physiology, cognitive biases, and certainly motivational direction. How this works, the extent of it, how you account for it in terms of mechanisms, that is controversial, but this is not super controversial here. What about substance use risk? Well, this research, most of what I'm going to present today is my own work, but in this case, it's not. It's actually coming out of Jen Lerner's lab at Harvard and was led by her trainee, Charlie Dorison. This was recently published think in Proceedings of the National Academy of Sciences. So the question that she was asking is, which specific negative emotions best predict smoking and why? The candidates on the table are those that are commonly used as categories in emotion research: sadness, anger, fear, and shame. And where she's coming from is that different negative emotions, they feel bad, but they have different biases in terms of where our attention is focused and kind of how we interpret what's going on around us. And the possibility is that it's not the negative affect that's driving susceptibility to smoking or risk for smoking. It's actually one of these other things that's associated with emotion. And in that case, it might be a specific emotion that's the trigger. So this is just the first of 5 studies that they presented. I'm only going to present 2 of those 5. That should be a comma, not a period. It was 10,685 participants in this first study. And this is the core wave of the midlife in the United States study. And they looked at actually 4 waves of this work. So each wave in this table presents a within wave regression, looking at the extent to which sadness, and then in waves 2, 3, and then the refresher, anger, fear, and shame experienced generally over the last few weeks, predicts either the onset of smoking or the amount that you're smoking. And so it's a regression that sort of throws all these emotions into the predictive algorithm at the same time. And this is controlling for a variety of demographics that we know are associated with smoking. 2 things to draw from this. The first, that of the emotions, only sadness shows consistent effects on current smoking. So how sad you've been feeling predicts whether you're smoking right now. None of the others consistently do. Fear, at one wave, that's it. Another finding is in the same analysis is that time 1 sadness among those who had ever smoked, it didn't predict initiation among those who had never smoked, but among those who had ever smoked at some point and then weren't smoking at time 1, because it's a study of midlife, right? So they had quit by time 1. Sadness at time 1 predicted the probability of a relapse both 10 and 20 years later among those who had been abstinent at that point. Now that's study 1. That's, it's longitudinal, it's good, and it does a nice job of controlling for the other negative emotions and kind of localizing it to sadness. I'm going to skip over studies 2 and 3, both of which continued to look at other emotions and found it's not the other emotions, it's very specifically sadness, to study 4, which was an experiment. And what they did is they brought smokers, overnight nicotine deprived smokers, into the lab, and randomly assigned them to a sadness induction that was a film clip paired with think about a time when you felt really intense loss, fairly recently or in your life, versus a neutral, which is you're looking at a video of a brick wall or something, or it's how to build a wall and then remembering a neutral memory. The sad movie was the first scene of the movie Up, which I don't know if you've seen it, but it shows a man sort of going through life with his wife and then losing her. It's devastating. It's really powerful. And then having done this, they measured affect valence, self-focused, how much is your attention focused on yourself right now, and sense of loss, as well as a delay discounting task with a series of trials of how long, which would you rather, would you wait this long for this many puffs or wait shorter for this many puffs, right? So standard delay discounting task, it's just waiting and puffing, as well as actual puff intensity when they finally get a chance to smoke the cigarette. What they found is that self-focus actually mediated the effect of sadness on puff impatience in the delay discounting task, not negativity, not sense of loss. So people in the sadness condition felt sadder. And that sadness predicted all 3 of those things. They did feel more self-focused, they did feel more negative, and they did feel more of a sense of loss. But it was only the self-focus that went on to predict impatience for the cigarettes. Moreover, the sadness induction among a subset of participants who went straight to, giving a chance to puff through a device that measures puff volume, it also significantly increased puff volume relative to the neutral affect control. So the point, different discrete emotions vary in lots of ways beyond negative affect per se or positive affect. distinct features of those emotions may be what is driving increased risk rather than the valence of the emotion. And knowing what those features are and what features can account for the effects of emotion on substance use can actually be really useful in informing effective prevention interventions and treatments. So in this case, you might want to focus on countering the sadness, yes, but particularly the self-focused part of it if you're developing an intervention. Okay, number 2. The goals of emotion regulation matter. This is building on work that I did in collaboration with my mentor as a postdoc, asking about the implications of when we're trying to regulate our emotions. Are we trying to turn the volume down on emotion generally, or the volume up on emotion generally? Or are we actually trying to change the channel? So this was a laboratory experiment. We brought people in, showed them really unpleasant film clips, sad ones and really disgusting ones from Fear Factor, if you remember that TV show, and just had them watch one set of them, but then showed them another set with explicit instructions to regulate their emotions. And what we found was that instructions to use what we call detached reappraisal, which is just disengage from your emotions and the emotional implications of stuff, just try to dial that whole gray out the whole emotion thing, versus really focus on finding some positive affect in this, had quite different implications for subjective experience, but also physiological responding and facial expression. So we saw very different profiles of consequences based on what you were trying to do. Okay. In the study that we ran in my lab a few years ago, we actually wanted to look at the implications of drinking with the explicit goal to make yourself feel better versus just drinking during a period of stress, presumably with some other motivation. And the period of stress I'm talking about was the first months of COVID. So this is a data set with over 250 community adults stratified to the approximate demographics of the US. That we collected from May through August of 2020. We're not in lockdown. We're kind of poking our noses out the door from lockdown, but stress levels and psychological distress levels were really quite high, as was alcohol use in particular. Each participant completed 22 days of surveys, one survey per day, with daily measures of the number of servings of alcohol that were consumed, as well as a couple of other substances, but not. We did look at nicotine and sugar intake, which actually talk about in a little bit, as well as the extent to which people used 17 different emotion regulation strategies to deal with pandemic-related stress. And one of those strategies was substance use. So we had 2 items measuring alcohol use in particular, intentionally to cope with pandemic-related stress. Every week, we measured depression, anxiety, and stress using the DASS scale. So here's what we found. When we think about predicting depression at baseline, we found that on its own, and that's not what this graph is, so when you only enter the number of drinks as well as demographics, you see a moderate negative effect on depression. We're calling this drinking while stressed. But when you add the measure of explicitly drinking to cope with stress, that effect is gone. So the purple bar is simply drinking during this period of time. The red bar is the effect of drinking to cope, and it's huge, right? On depression at baseline. The pattern is the same when we look not at predicting baseline depression, but looking change in depression from day 1 to day 22. The effects are smaller because a lot of it's already set. A lot of the predictive value is eaten up by just continuity in depression, which tends to be high. But it's still a significant effect, and that significant effect is localized to drinking to cope. It's not about the amount that people were drinking per se. I'm going to just flash through the 2 sides to make the point that we saw the exact same thing for anxiety. Now we have lingering day 1 to 22 change in anxiety effects that approach significance, and for stress, where the effect for the change over time is not significant, but you still see that. I think the size of the drinking to cope effect was like 4 to 5 times the size of drinking per se once you when you throw them both into the model at the same time. Okay, so implications. Drinking with the explicit aim to reduce stress and distress during this period of time predicted worse mental health. That's not a huge surprise. We know that. What's striking is that when you account for them both in the same data set, drinking during a period of stress, but presumably without the aim to reduce distress, did not show that same effect. This gets back to this point that people use alcohol and other substances to achieve a variety of emotion states. So when people were drinking during this time, not to reduce stress, like I was doing it, I bet some of you were doing it too. It wasn't always to reduce distress. Sometimes it was, I'm on a Zoom happy hour with my friends. I actually just want to have some fun. Or I want to relax in a way that's not necessarily about stress or distress, but it's like that vision of you're sitting, with a book by the fire and just enjoying yourself, right? And so there are other states that may have motivated or aims to achieve other emotional states with substance use that may not actually have been the, I need a drink, right? And that, again, that may be consequential, that the goal of substance use may be at least as important as the use per se for predicting some outcomes. It's actually really helpful to know that and to have a better attunement to what goals people are bringing to the table. Okay. Number 3, the strategy that we use matters. And where I'm coming from with this is, as a basic affective scientist, is a very pervasive focus on one strategy in the vast majority of the huge literature on emotion regulation in the field. And that's cognitive reappraisal, which is thinking about the situation that you're in a way that alters how you feel about it. So a classic example is someone bumps into you in the street and you go, or cuts you off right when you're driving. And one reaction might be, wow, they're so inconsiderate. They did that on purpose, right? And then to get angry. But an alternative is, oh wow, that person must be so stressed out, right? They didn't notice. They're super stressed. And then you might have either a neutral affect or even compassion. Nothing about the objective situation has changed. It's just how you interpret it that's changed. Again, nothing new for you guys, but that kind of thing is really like, that is the emotion regulation strategy we've been studying. And with a particular focus on detachment, which is literally the instruction in most of the research is try to think about what you are experiencing or seeing in a detached and unemotional way so that you feel less emotion. I'm not sure that's actually a healthy instruction to give people most of the time. I grant that it is for some people some of the time, but that's what all of our work is based on. And it is, globally speaking, this strategy of thinking about situations differently to change your emotions has been associated with higher psychological well-being, lower depression, closer relationships in the long haul, and reduced risk of cardiovascular and metabolic disease. But we also need to be studying other strategies. And in this study, we were interested in looking at which emotion regulation strategies that people might actually want to use on a day-to-day basis in the moment could be helpful at reducing sugar consumption. Why am I talking about sugar consumption? Well, it's what this study was, and it's appropriate, but it also has a lot of similarities to alcohol use in particular in terms of the risk factors for use and the emotional susceptibilities to use in terms of the relation to stress. So I think it's a useful tentative model, although I'm actually going to talk about some research where there's differences as well. So in this study, it's a lab-based study. We brought 200 folks into the lab. The first thing we had them do was describe and then really ruminate on a current source of distress, like tell us how awful this situation is and all the ways that it could be negative for your life and how bad it's making you feel. We then gave them a specific instruction for how to deal with those emotions and had them think about it for a little bit and then write about the situation a bit more. We then told them that they were engaging in a separate task, a separate study. And we basically said, okay, in this next part of the study, we're actually studying cognition. So we're going to have you do this series of anagram tasks. You're going to have about 10 minutes to do it. We're not going to lie, they're hard. And it's, we're sort of looking at the relationship with intelligence. We know it's kind of tiresome. And it's kind of the middle of the day. So here's some snacks, feel free to help yourself. And we plunk a basket in front of them that includes little mini Halloween candies, as well as a number of single serving healthy snacks like popcorn and little slices of apples and stuff like that. Help yourself. It's all jumbled together, so nothing is particularly salient. And of course, we have a count of what's in the basket. And we let them at it. So needless to say, afterwards, we're counting what they ate. So which of the strategies that we instructed people to use relative to a control condition where they just kept thinking about their source of stress or distress, but without the emotion regulation instruction, most reduced the candy consumption relative to the healthy snacks? Here were the emotion regulation conditions that we used. So the first was what we call challenge appraisal. This is think about what you're experiencing as a challenge for you to overcome. You can do it. We believe in you. You got this. You can handle this. The second one was an awe-based relaxation or distraction task. You're actually going to see this again in my talk today. So think about a time in your life when you were someplace awe-inspiring and beautiful, and just put yourself in that space and relax and enjoy that space for a little bit, and then come back to us and move on. The third one was imagine social support. Imagine someone who you really trust and you know care about you coming to you and giving you a big hug and telling you it's going to be okay. Okay, so those were the three conditions that we had for the active emotion regulation instruction. And then a fourth condition was just a control condition that said, tell us a little bit more about this distressing situation that you're in. In this graph, we're looking at the snacks that people consumed. The blue bar is the number of candy items that people consumed, and the red bar is the number of healthy snacks that people consumed. So we did this in a factorial ANOVA because we wanted to make sure that what we're not looking at here is just overall increase in eating or change in the volume of eating, but really a specific focus on candy. And in fact, we didn't see any changes across these conditions in the total amount that people ate. What we saw was the proportions of consumption of candy versus healthy snacks. So in the control condition, not surprisingly, people ate on average more candy than healthy snacks. We don't know whether this is just a stick, like that's just what people would have done if we brought them into the lab and thrown the basket at them, or if it has something to do with the distress per se. What's striking is that the challenge instruction eliminated that completely. So they were still eating some candy, but again, these are averages across people. But on average, folks ate around the same amount of candy as healthy snacks, or the problem, you can think of this in terms of probabilities as well, as though these are means, transformed means, because we did see some skew in these variables. One thing that really jumped out to us, though, was this. We were not expecting this at all. So in a social support condition, people really went to town on the candy. There was something about that that just kind of said, oh, I really just kind of, can I have some chocolate, please? Right after imagining getting that hug from a friend, which was really striking. And then the awe, relaxation, and distraction condition was not significantly different from control. So the upshot of this is that our emotion regulation strategies, although they all made participants feel better, there were no differences among these three strategies in how people felt after implementing them. Relative to the control condition, everybody felt better, less negative and more positive. But only the you got this, the challenge appraisal strategy, actually reduced candy consumption. And the imagined social support condition actually made it worse. So it raises the question, is there something fundamentally problematic about that strategy? The point here is that what we found is that simply reducing negative affect did not protect against temptation, right? All of these made folks feel better, and that was not enough to reduce the candy consumption. There was something else about the strategies that seemed to impact whether people increased or decreased their consumption of candy. Now, this again is candy, but for a lot of reasons, I would bet that you're going to see similar effects for alcohol and other substances, especially among teens. Okay, moving forward, I'm going to continue this theme of that we just sort of built on of, well, social support made people feel better, but it actually had this detrimental effect on sugar consumption. What is going on there? Is it a good strategy or a bad strategy? Well, now what I'm putting on the table is there are not necessarily good or bad strategies across the board. It really depends upon what outcome you care about. So here's an example from basic affective science. We've done a lot of work on what the effects are of suppressing how you feel, suppressing your expressions. So I said earlier that most of the research has looked at this detached reappraisal as like the go-to strategy. you have to compare it against something. And most of what it's been compared against is this: hiding how you feel as the contrast condition. Basic message: reappraisal, good; hiding your feelings, bad. Okay. But it's a little more complicated than that, right? Hiding your feelings is effective at modulating your feelings. People can't see what you're feeling, but it doesn't impact how you actually do feel. It can actually have a negative impact on physiology, and implications for social interaction depend on your context. If you're hiding that you're angry, if you're hiding that you're disappointed, if you're hiding your amusement in a situation where laughing at someone is really inappropriate, that can be socially appropriate and therefore good. But it can also, especially if it's chronic, be hiding yourself from people that you're trying to have a relationship with. And that tends not to go well. So it really depends on what outcome you care about. Now, that finding that I just reported about the imagined social support emotion regulation strategy leapt out to us. We were like, what is happening here? We didn't see this coming at all. We put that in there at the first place because we imagined social support to be good. It's because perceived social support is good. There's this massive body of evidence that perceived availability of assistance and comfort from other people is not only a defining feature of high quality, rewarding bonds with others, but it's also a potent predictor of mental and physical health. It's an even stronger predictor of mental and physical health than the actual availability of support and the size and depth of our social network. And we actually are still trying to figure out why. So the question is, why is this having toxic or negative effects in that study? And is there something about that strategy that's more globally problematic that we need to know? So remember that coping with COVID-related stress study that I talked about earlier? We had 17 different emotion regulation strategies that we measured on a daily basis. And 2 of those involved emotional support. We had items that measured seeking emotional support from others, comfort, hugs, and then seeking instrumental support or concrete practical help from other people. So we wanted to know this weird thing where it's like bad for sugar intake are we going to see that in that data set too? This is just the model that we used. We're basically looking at a lag effects modeling and multi-level modeling. So what we found consistent with prior research is that the effects of reaching out for social support, I want to say that, reaching out to others for emotional and instrumental support, for your affect valence, for feelings of closeness, these are all at the day level, and relationship satisfaction at the day level were all positive. So social support seeking was good for how you feel and the quality of your relationships. It was also good for physical activity. People got more exercise on days that they reached out to loved ones for emotional and instrumental support. But check this out. We see the exact same thing, where on days where people were reaching out for more support, they also consumed more sugary foods and more sugary beverages. So we're still kind of figuring out the implications of this and what to do about it from a translational standpoint. Oh, so here's the other thing. This was completely specific to sugar. We measured alcohol and nicotine consumption, and we did not see the same negative effect for those. And we didn't see any of these kinds of, we saw all the positive effects, but not the effect on sugary beverages and foods for positive emotion inducing emotion regulation strategies, which were these. So there was something in this data set really specific to seeking social support as a way of coping with your stress and distress, and sugar consumption that's now popping up across studies, which again, we're talking about sugar, not substances, but for me, really raises the question of, are there other kinds of specific effects for other kinds of substances that we may use in this space, and really has kind of alerted me to the possibility that that might be the case. We're not going to look if we don't, we're not going to find it if we don't look. So something to really keep an eye out for. Okay, one more to share with you. Oh, the implications. Okay, so social support seeking, is it a mixed bag? Why? But again, more broadly, we can see these weird effects that we're not expecting and not looking for of emotion regulation strategies that do make us feel better, but may actually end up promoting something that we don't want. And we really need to have our eyes open for that. Okay, wrapping up, a plug for positive emotions. So I'm a positive emotion researcher, which makes me very interested in a small but growing movement to ask whether we can leverage our desire to feel positive emotions and our enjoyment of them in the behavior change space. The vast majority of work out there has either looked at reducing stress to promote positive and healthy behavior, or to frighten people into healthy behavior. Was there a question that I should address quickly?
We can wait until the end for these.
Okay.
Yeah, thanks.
I'm closing in on the end here.
Okay, thanks.
So a lot of positive emotions are good for motivating us to act, right? They energize us, they tell us to go get it, they increase appetitive motivation and reward orientation, physiological arousal, and reliance on stored knowledge, kind of confidence that we know what we're doing in the interest of pursuing some kind of reward, whether it's material or social. But there's this interesting thing called awe, which I've been studying for a long time, which actually has the opposite effects. It slows us down. It pauses our behavior. It orients our attention toward whatever is inducing our awe. It actually soothes our physiology, especially our cardiac arousal. And so there may be situations where that's a good thing. That state is pleasurable, but it also counteracts in this case, craving that we might be experiencing. So I will say this is a pilot study. I have been trying to get someone to pay for a full version of this study for many years, and I just gave up. But I might try again with the CTN. We'll see. Tell me what you think. So in this study, it was run in collaboration with Scott Leischow, who's at ASU, is a very, very well-known nicotine treatment researcher who was at the Mayo Clinic at the time, is now at ASU. So we brought folks in who were overnight nicotine deprived and had them engage in a cue-evoked craving task. Really mean open pack of their favorite cigarettes and a lighter and an ashtray on the opposite side of the room in a corner under a camera that's focused on them and is recording them. We then gave them a regulation instruction for regulating craving. And there were a few conditions in this. I'm going to focus right now on a control condition, which is just stare at this kind of boring picture at the wall, versus look at this. It's not this picture, but it's a very similar picture of Sedona, Arizona, which is spectacular. Just look at that picture. It's just to their left, so we can see them looking at it on the film, on the video. Just look at it. Imagine yourself being there. Enjoy that feeling, and then go back to your task. What is the task? It's 20 minutes of really tedious cognitive tasks. This is Raven's progressive matrices. If you've ever done one of these, commonly used in intelligence testing. And we had another task too. It was a word find task. It was like sitting there for 20 minutes while you're jonesing for nicotine. And yes, we used a carbon monoxide monitor to make sure that they were actually jonesing. And looking at this, pack of cigarettes on the other side of the room. So I'm going to focus on this awe distraction condition and its benefits. So check this out. These are huge effects, by the way. Reduced subjective craving. It reduced the number of times that they looked at the cigarette pack, which are really, if you're looking at the video, it's really obvious when their eyes flick over there. You can absolutely see it relative to control. It increased their attention to and performance on the cognitive tasks. Other regulation instructions we gave people, including one where they're looking at a pleasant scene of people sitting in a cafe, had some of these benefits, but not others. So awe distraction was the only one that really actually showed all of these benefits. Now, craving regulation and contingency management, right, reward people for not using, basically, are currently the main applications of positive emotion in substance use research and addiction science and substance use treatment. My point here is that other positive emotion states might be really useful in buffering against other risk factors. And in this case, I still would make a strong case that, if we can find a way to port it around, which with VR we can do pretty easily at this point, should help us reduce craving. Okay, take home points across the entire talk, and then I'm done. Most substance use involves some kind of goal for how we want to feel. I'm not claiming that this is the only trigger or risk factor, but it is certainly one of them. Those goals extend way beyond reducing stress and distress. treatments and interventions can benefit by acknowledging these other goals and teaching other ways to reach them. And basic affective science offers theoretical advances, conceptual frameworks, empirical research, and some practical techniques that can help inform these aims. So these are my collaborators and funders on the work that I've presented today. Thanks again for listening. And we've got a few minutes left, so I'm happy to take any questions or just engage in discussion, whatever's helpful for everybody.